Ready to tackle the topics that you've been curious about but never felt comfortable asking? With a straightforward, no-nonsense perspective on life, blended with candid stories and a healthy dose of humor, Dr. Mary Grimberg cuts through the fluff and addresses the conversations we all need to have on TMI Talk, where no subject is too taboo. Our bodies, our minds, and everything in between. Now here's your host, Dr. Mary.
Hello, everyone, and welcome back to TMI Talk with Dr. Mary. I'm your host, Dr. Mary. If you're watching the video, you'll see that we're in our new podcast studio here in Austin, Texas. So this is one of the rooms in my office here in Austin, and we absolutely love it. We just moved a few weeks ago, and the space that we have here is more quiet. It's allowing us to expand to more practitioners and provide a safe space for healing for our clients. And so if you see that adjustment, you'll see me between here and my home studio. But anyway, so I want to make an announcement, though, that I'm going to be switching directions. And what I mean by this is before I was focusing so much directly to people and understanding pelvic pain and all the things surrounding it that we don't necessarily correlate directly with healthcare, but there is, right? Like lifestyle changes, work, all these different things that affect the body. And what I've decided is that we're going in a direction that focuses more on health and movement professionals because I see there's a massive need for incorporating the mind, body, soul into the healing aspects. And I say that because we treat a lot of people in chronic pain and they've been misdiagnosed over the years, or people haven't known how to help them. And knowing some of these techniques and knowing some of these tools can make a massive difference. And by talking directly to health and movement professionals, we can cast a wider net to help people quicker and sooner. And that doesn't mean if you're not one of those people that you can't listen. I think you'll still get a ton of information out on this, but you'll see who I'm talking to is going to switch a bit. So you'll see that. And I'm really excited because honestly, I've taught physical therapists over the years continuing education courses. And when I do that, I just feel so alive. I feel excited, and I really believe this is the right path for me. But in that, I won't just stop at physical therapists, right? I want a collective movement of health and movement professionals, because those are the people that are directly working with people, and they get to spend more time with patients, especially people in the rehab world and in the movement world, because we're spending more time than they often do in the healthcare system here in the United States. So the sooner we can help them and identify these things, the sooner that people get better, the less we're in chronic pain, and the more we can really help this opioid epidemic that we don't need to have, but it's here because of the lack of understanding that we have of the cohesiveness of the human body here in the United States. And so I'm going to break down the main ways that I do this. So first is going to be the biomechanics, right? So traditionally in biomechanics, we learn, well, the joint moves a specific way. When we walk, this joint moves in this direction, right? And so when we think of it that way, it doesn't necessarily work that way all the time. And if we don't incorporate the nervous system, so for instance, say if my knee is tight, right, because I'm not getting that posterior gliding of the femur on the tibia when I'm walking or bending my knee, what happens with that is that we're not incorporating, okay, well, you might want to mobilize that knee. But when you're doing that, if we don't address the tissues around it that are tight and restricted, we can mobilize that joint all day. The tissues are going to keep it from moving. And those tissues are muscles, but oftentimes what is often missed is understanding of the fascia. The fascia is tissues that are connect all of our organs. So our visceral organs, our muscles, right? When I was learning physical therapy, so much of the fascia was more focused on, oh, this holds the muscles in place. It's more of a structural thing than it is a neurological. And what we know now is that the fascia constricts and relaxes with the nervous system. So it's more part of the nervous system than we've ever thought before. So if we're ignoring one of the most important parts of our body, we're going to miss a lot there. So understanding the nervous system, how fascia is incorporated with that, understanding lymphatic flow, right? So there's so much about the lymph system that's important that if we know how to move. So the lymphatic system, it doesn't have, like with the venous system, it has its own little pumps in the system, like in the valves. We don't have that in the lymphatic system. What we have are muscles that help push that lymph back through our body. And the lymphatic system is super important because it's a major part of our immune system. So let's think about this. So say if we're stagnant and we're sitting at the computer all day, or you have a patient that's sitting at the computer all day, they're not moving, their eyes are focused on the computer, they're rounded shoulders. Is it the pain from the rounded shoulders? Is it the posture that we've always thought it was? Or is it the fact that we're in this forward position, we have the vagus nerve in the front of the neck, we're not able to activate that part, we're not breathing through our diaphragm, and then we're stuck in this position, not moving for hours, and we're focused on a target. Now, if we look at that from our primal instincts, our body thinks we want to attack. So our nervous system is going to respond cohesively with that, right? So we're going to feel tense. We're going to feel anxious because we want to fight. And so in that, what do you think happens with the muscles? So the muscles are going to tense up, the jaw is going to tense up, the pelvis, right? Because what's physiologically happening is the blood is diverting away from our gut and our digestive system, because the last thing our body wants to do is poop when you're running from a bear. Also, we likely don't want to have sex during that time. Some people do get more aroused when they are more stressed, but in general, the blood flow diverts away from those organs because it's trying to prioritize that. So much of this in the nervous system is understanding our primal instincts is to keep us alive, and our brain gets to override that. And so in that, the biggest thing with the nervous system, so these are all incorporated. So I talked about the nervous system, the fascia, the lymphatic system, but also too, just knowing how our primal instincts work, right? And so this goes in with the nervous system. If we're not moving all day, like think about thousands and thousands of years ago, how people moved, right? We didn't have computers, we didn't have technology. These are all gifts, these are wonderful things, but like anything, the pendulum can swing in the opposite direction. And that's what's happening here. We're wondering why people are in chronic pain over years and years and years. But if we look at their lifestyle, we're not moving, we're not eating well, we're not in community, right? And so look at those primal instincts. We need community, we need nourishing food, we need, let me rewind, supportive community, supportive and loving community, nourishing food, we need movement, and to pull ourselves back into our body. So the next aspect too is understanding somatics. And somatics is basically pulling yourself into your body. So much of what we do is from the neck up. And so if you think about it, if we're disconnected from our entire bodies for a long period of time, what do you think that tells our primal instincts? Go. We are fighting for our lives. We are going, going, going. So much of anxiety, so much of depression and things like that are when we're so much in our head and not in our body. And understanding techniques to help pull people into the body. And things like we hear a lot of terms like this, like breath work, mindfulness. There's so many different ways to do this, but and everybody's a little different. So there's not a one size fits all. In my experience, the goal is to get people in their bodies so they can start trusting their bodies again. We call this interoception if you're looking at it from a research standpoint. So just understanding your own cues, right? And if you think about how do we get ourselves into our body? Well, there's so many different things, right? So say if you have a client that comes in, they're all flustered, they maybe just got off a really stressful call. Maybe they're caring for aging parents and they're already dealing with chronic pain that people can't figure out. Is that somebody we're going to push that day to maybe max out with lifting or maybe really push with some deep tissue work, right? There's a difference here. And so we have to adjust based on that person's nervous system. So that person may not be the same person every time they come in the door. And so we get to adjust with that. And I feel like so much at least in the physical therapy world, we get stuck on protocols and, oh, I didn't learn this in school. I didn't learn this in Con Ed. But the goal is also too to teach you intuitively how to adjust with the patient or the client in front of you, right? And so there's not specific protocols when we listen to gurus, or we take things at blind face value, we're not digesting it ourselves. So it's your interpretation of the messaging, and you get to provide that with the patient. Obviously, like regarding safety and things like that, there's protocols and things to avoid, right? Especially like if we're dealing with a carotid artery, we're not going to necessarily massage right in the carotid artery because we feel intuitively necessary to do that. My point is more sticking with the safety protocols of understanding, hey, basic things like I said, with the carotid artery, and then just being careful, just knowing the anatomy and knowing, hey, what are some safe things to do with this person and not, right? Like if somebody has a really high blood pressure of 200/100, we need to be calling their doctor, or likely sending them to the emergency room. This is somebody we'd consult with their doctor before doing anything. So this is not just so woo that we're just so disconnected from the body. And so where I'm going with this is starting to trust the body. So we have the body has its own brain, and then the brain gets to interpret it. And so we've seen this with research. So Lorimer Moseley is a big researcher in understanding chronic pain and understanding that the body gets to just determine what the message is, right? So the body tells us pain, 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 but then the brain gets to interpret it. And so if we don't know that as clinicians or as movement professionals, and we're stopping every time somebody has pain, we're reinforcing this kind of false narrative that something's going off. I think he uses the analogy of a fire alarm. So the fire alarm going off when there's not a fire, right? And so it's important that we interpret those messages. And so you're going to see me starting to talk more about somatics and things like that. Now, if we start looking, the next piece is going to be understanding Eastern medicine and all of this. And so Eastern medicine can be so many different things. You might be thinking, what does this mean? Well, let's put this into perspective here. Modern medicine has been around for about 150 years. Eastern medicine has been around for about 3,000 to 5,000 years. You can look up a bunch of different things, but think about that for a minute. There is wisdom in our bodies. And I'm not saying this from a woo perspective. It's very important that I come across scientific, but also understanding the wisdom of the people before us, thousands and thousands of years. And they've been able to tap into something called a higher consciousness, right? So a higher consciousness is when we're connected higher to the spiritual realm. And here on earth, a lot of times we call it like lower consciousness, is when we are so focused on fear and scarcity and in the world today, and grab, greed, all these things. So you see that a lot happening. This is why we are in mass chaos right now. And what I mean by that is that the more we can get people to understand their body wisdom, again, these all interconnect, like I said, with the somatics, but getting them to understand their own internal cues and things like that. And so with Eastern medicine, for example, say somebody comes in with chronic neck or jaw pain, right? And they're just constantly super, super tight. And we keep telling them to relax. But here's the thing. Many people don't know how to relax. They never been taught. So what we're telling somebody is almost reinforcing this shame cycle. They know they need to relax. Let's be honest. They just don't probably know how. And I was one of those people. I was like, why is everyone telling me to relax? I don't understand. How do I relax? Right? And so they don't have the tools yet. And so we're not psychotherapists, right? Unless you are a psychotherapist. But we're not taking on their traumas. We're not talking through their traumas with them. We're just helping their body understand what is going on. And this is massive. This is life-changing for people when they understand this. And so much of what we do in the clinic, and what I've seen in the past 14 years with my clients, is just teaching them to feel empowered in their body. It's not about our ego. And so like I said, with Eastern medicine, so if somebody's coming in with chronic jaw pain, yes, we still are going to work on the jaw. We're going to work on the upper neck. We're going to work on the first rib. We're going to do all of the things, right? We're going to show them exercises. We're going to assess the jaw, right? And if you're a physical therapist here, or a chiropractor, anybody that's doing body work on patients or clients, in that, where also the Eastern medicine part comes in is this is speaking your truth. So I'll say to somebody, where are you not showing up authentically as yourself? Where are you not speaking your truth, right? And so we're combining the two things. And when I say spirituality, what I mean is your inner wisdom, right? And so what that means is understanding your own cues, understanding your own thoughts and your own messages outside of the world around us. So it's a very important thing for our health. I believe this is why we have a lot of health issues, not blaming all health on this, but a lot of things that people can't figure out. Yes, sure, we have neuromuscular diseases and things like that, but there are some people that have chronic pain and chronic illness that's unexplained, and they don't know how to interpret their own messages to get the care outside of them to know where to go. Because a lot of times, what I see people doing is they're going outside of them and looking, and they're just not getting answers. But sometimes it's sitting with yourself and getting people to understand the messages. And Eastern medicine helps guide us based on where things are in the body, right? And so, for instance, maybe somebody with chronic tailbone pain, so that's the sacral chakra, and in that we also store trauma in the pelvis. So what are some unprocessed things that they're maybe holding on to that they haven't addressed? And so another thing in this area too is creativity. So if somebody's constantly coming to you and they do really well with exercises, but then it kind of keeps coming back, so we know there's a physical component, right? Now we get to go to the emotional and inner wisdom, so the soul part, where they get to decide, oh, well, you get to guide them and say, where in your life have you been creative lately? Where have you explored a creative outlet? And so the body gives us signs, and Eastern medicine helps us to interpret some of those things. Obviously, Eastern medicine is so many different things. I'm not just breaking it down to just these things, but in order to bring it into Western medicine and into our culture and to make it more cohesive, we have to understand some of the basic stuff, and then it kind of builds from there. And I say basic because these are things that were not taught to me. I've had to learn as somebody on the other side, because I'm on my own spiritually healing journey. And what that means is just understanding your own body, understanding why we're here on this earth. And this might sound woo, but if you look up, there's about 85% of people believe in something higher. And if we're not incorporating this into understanding that in our healthcare system, we're missing a piece of people. And this isn't, I'm not saying religion, and we don't need to be pushing religion or anything on that. But for instance, if somebody's coming in and they're super stressed and they believe whatever God they believe in or whatever spiritual entity they believe in, if it's a benevolent force or whatever it is, how can we get them to tap into that? Hey, what are some prayers that you typically do? Have you connected from that standpoint, right? So getting them to understand how that can help support their nervous system, right? And so if we know something outside of us can help us, that can help calm the nervous system, right? And everybody's going to have different beliefs. And so that's a little bit more of the spiritual side. And then, also just understanding so much of diet, right? So the gut is so connected to the brain, right? And so if somebody's constantly bloated and they're having back pain and they're anxious, right? Well, think about how the whole body works together. So let's look at this for a second. So the rectum is right in front of the sacrum. And so if somebody is constipated and they're having chronic back pain, how can that not affect it, right? And so the rectum can push upon that sacrum. And we also have, so if somebody has a uterus, the top of the uterus, we have the uterosacral ligament. So that's the uterus, the ligament that connects the uterus to the sacrum. So it holds it up, right? Those pelvic organs are not just supported by the pelvic floor muscles, they're held up by ligaments that hold up the pelvis or the pelvic organs. And so now you've got that kind of pulling down, and then it almost pulls the lumbar spine more into lordosis. So you've got so many of these different aspects right there, right? So you've got the rectum, then you've got the vagina and uterus, and that's all pushing, and that can be tugging on that uterosacral ligament. Even if, and that goes to show too, like on different phases of their cycle, when are they experiencing this? And so I'm going to be starting to incorporate all of these things, because then we're looking at it from a visceral component. Another aspect is going to be too of understanding how the entire body is connected. I just had a patient come in the other day that was seeing 3 or 4, maybe 5 physical therapists, and they were told the whole body is not connected. You all, we really need to understand, it's our responsibility to understand how the body is connected. And so if my heel strike on my left foot, if I'm not heel striking, or I'm not. Another one I actually see a lot of is people not pushing off through their forefoot. So they're not getting that full push off. So then their calf is not pushing off. So then if we think about how that we need that lymphatic drainage to occur, so starting maybe in the calf, if we're not, the lymph system doesn't have its own pump, we use our muscles to do that. So then maybe somebody might have swelling in their feet because we're not pushing off efficiently through that forefoot. I find this a lot with older clients where maybe they're not pushing off through that area. So then they start to shuffle. Then the gait starts going off. Then they're not getting as much thoracic spine rotation. Then the hips have to overwork because we're not doing that. Or their arms swinging, right? So a lot of times people maybe hold their purse on their right side and then they swing their left arm. Well, now we're not getting that right-sided rotation, right? And so we need all of this movement to help the body move efficiently. So from a biomechanical standpoint, from a lymphatic standpoint, from a fascial standpoint, from an emotional standpoint, right? So kind of going back more to Eastern medicine, so much of this is stagnant energy. And so we are made of energy. We are made of atoms, which and understanding how all of that intertwines. So we do emit energy. We study this in radiology. We have the EMG studies the brain. We have the EKG that studies the heart, EMG that studies the muscle. So these are true electric pulses that are measuring it. And we can't deny that because it's in science now, right? And so there's research coming out to show when the heart rhythm and the brain rhythm are together, then we're really feeling aligned and we're really in our body. And then that's when we can connect ourselves to feeling more calm in our nervous system. And so just knowing that from a scientific point of view, right, this can go in so many different ways because then the cells start to beat at a frequency or vibration that helps us heal as well. So this isn't woo. This is really, you're gonna start seeing more of this stuff start coming up because people are not doing well here in the United States. And so, again, looking at the whole body, how it's connected, how we look at it from a fascial standpoint. So biomechanical, so the joints, we've got the fascia, we've got the lymphatic system, we've got looking at somatics, so understanding our body's internal messages. Then we've got more of some of the Eastern medicine side where we're looking at emotions in the body, where people maybe not speaking their truth, where are they not expressing themselves, where are they holding back, and the body will show us in those different patterns. Looking at diet, if somebody's chronically bloated, that's going to affect their brain. One thing I didn't mention is about 80% or so of the serotonin is produced in our gut. So if our gut is irritated, we need serotonin. And then also looking at more of the visceral organs. So if somebody's back pain, what's going on, what phase of their cycle? I think so much we think of the phases of cycle as when somebody's menstruating. But if you look at the luteal phase, that's when we see the progesterone and estrogen spike. So progesterone is more than estrogen around that time. So understanding how those hormones can affect the body, right? And so, or mid-cycle, right? Estrogen's going to spike during ovulation. And so are they having more symptoms during that time? So if you're working with people that have a uterus, just making sure that we're keeping all of these things in mind. This might sound like a lot, but this episode is really kind of summarize you of what you're going to be hearing from me in the future to help your clients understand how the full body works together. And a few other pieces on top of that. I know I haven't really touched on everything. There's so much that I want to talk to here. There's so much to go through, but getting people to understand and to be honest, so much of this starts with us, right? So us and taking our ego out of it. So we've got two aspects. So you've got your ego and your higher self. So your higher self is basically who you are, or who you are without your ego, and what your mission is here on this planet, right? Everybody has gifts. And so much of our lives, we focus so much on ego. And I've seen in healthcare, and I've been here myself, where if somebody doesn't get better, I immediately want to blame them in the past. And what that means is I was telling myself, well, if I'm not good, I'm not a good person. And we have to really check our egos at the door. And this takes our own self-work. Okay, this takes a lot of self-work to do and a lot of groundedness. So our own experience in these things, in my experience, to my knowledge, and I'm yet to see this, it is almost impossible to be able to help people heal if we're not doing the work ourselves. And so it can be incredibly humbling. And so if somebody's not getting better, let's give them the benefit of the doubt. Yeah, they may actually not be doing it, but why? Are they depressed? Is there a lot going on at home? Can we give them tools to help their nervous system? Because a lot of times people go into fight, flight, or freeze, right? And so if they're freezing, what's going on? Why are they freezing? How can we help them come out of that freeze versus, oh, you're not doing your stuff? Well, that person might need some extra support. Maybe they just need to listen to somebody that, just to express what's on, they're processing right now. Hey, I'm just going through a lot. Maybe I'm caring for aging parents or whatever that may be. And so then we get to take them through exercises to pull them in their body and then tell their nervous system that they're safe, right? So much of this is knowing how to talk to show the body that it's safe, because the brain, this is why gratitude journals and things like that don't work. You can't trick your brain out of it. You've got to physically feel it in your body. And so if you're grounded, it's easier to help people and take your ego out of it. How can I show up for them? What space can I provide? So if you're coming in with an energy that's really intense and anxious, that transmits, right? And so when that happens, we are making it less about the client and more about us. So what can we provide in the environment that helps them soothe, right? Looking at sounds, smells, colors. How are we speaking? Are we using the same tone that they're using? Are we standing over them and talking down to them? These are all things that tap into our primal instincts that tell us that we're not safe. So we could be inadvertently providing an unsafe space for somebody to heal and then blaming them for not getting better. So, and I really don't believe people are doing this intentionally. I really want to just bring awareness to this because I've done it in the past and I've seen how much it can make a big difference in how somebody heals. And making the session about the client, right? It's an exchange of energy. They're paying you, which is money. Money is energy, and you're giving your physical energy to them. So if they're paying and then we're putting our energy on them, they're kind of paying twice. So thinking of it from that perspective. But then overall, I want to tie in how research comes into play, like interoception, right? When we understand our body's cues, when we know what the triggers are, pulling in our senses, understanding heart rate variability, that's going to be super important. That's a good way to measure somebody's stress and get them to start seeing it, right? And so heart rate variability is, people are doing it already, right? They have their watches, they have their rings, they have the different things. And a lot of times they don't know how to interpret that data. And so heart rate variability, for instance, is going to be amazing. And like I said, you're going to see a lot of stuff starting to come out about this. I've just been researching it a lot and understanding the frequency side of all of these things. And so what that means is that when your heart rate, so say if your heart rate goes up and down and up and down and up and down, when we're anxious, it's beep, 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 beep. There's less time in between each heartbeat. So so it's measured in milliseconds. So you have less time. So if I have more time, beep, 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 right? I'm in a calmer state. And so what heart rate variability does is it kind of takes an average of all of those in-betweens and tells you where you're at. So if you spend most of the day with a lower heart rate variability, you've probably been in more chronic stress because your heart rate's been going faster. And now there's not specifically a subset of specifics for people on the guidelines for this. It's really going to be based on that individual. Like, for instance, I went back and I looked at my heart rate variability, which I had no idea was back in, 2019 when I was diagnosed with cancer. It was very low. It was around 30 milliseconds. And now, as I start doing more of this grounded healing, exercise, pulling myself into my body, and again, using science to back all this up, like I said, with the heart rate variability, I see now my heart rate variability is closer to 50 to 60. That's a drastic difference. And I was eating healthy and I was exercising, right? And I was doing all the right things. That's what turned me to all of this. I've been a teacher for a physical therapist. I've done the orthopedic residencies, the residency. I have take ongoing continuing education courses. And it wasn't really until I got sick that's when I realized, holy shit, we're missing so much. And so the cool thing is you get to do this. It's science backed, right? So there's different parts of the brain and different parts of the body. We've got the vagus nerve. So you're going to start seeing a lot of stuff about the vagus nerve. It's so important because the vagus nerve connects to all of a majority of our visceral organs, right? And so it's going to respond to stress. And so you'll see sometimes people are stuck in the sympathetic dominance. And what that means is that their body just cannot come out of it. So we have to teach them how to come out of it, right? So we're really coming at this from an anatomical and physiological point of view as well. And so different things. So the vagus nerve is going to be right behind the throat as well. So that's why humming and breath work and singing, those are going to be good ways to kind of laughing. Those are going to be good ways to kind of bring that down. Also thinking about laughing. Laughing is going to release dopamine, serotonin, and oxytocin, right? And so before I would think when I talk to somebody and maybe we didn't do as much exercise that day, but they still felt better. Well, think about what we just did for them. We helped get the pharmaceuticals in your brain starting to work for you, right? And so again, we're not taking it on. We're not taking on from a mental health perspective, but we're teaching them about their bodies and just reinforcing those messages. And in summary, looking at the whole entire body, the biomechanics, looking at the anatomy and physiology, right? Especially, like I said, you're going to start seeing more about the vagus nerve, pulling people out of that dominant fight or flight response in order for them to feel safe, right? Understanding how emotions are going to be showing up in different parts of the body to give us messages of where to help people guide while still treating their physical symptoms. It's very important that we do that because people can feel gaslit otherwise. I've been on the other side of it and been incredibly frustrated and just felt lost. Again, understanding fascia and understanding more things that are going to be coming out, especially HRVs. That's going to be a super quick and easy one for you to be able to help people with. So in summary, I'm really excited to share this with you. It's taken a lot for me to be so open with my approach, but I realize this can help a lot of people. And I'm so excited to be on this journey with you to explore, because really what this is doing is it's also your own healing journey as well. And I think we can impact a lot of people and make a big difference. And I really feel aligned with this. And I truly believe this is my life's work. So thank you for listening. And I'm also going to tag below my newsletter for you to be updated on any education topics or webinars or courses or speaking opportunities that I will be a part of. So thank you so much.
You've been listening to TMI Talk with your host, Dr. Mary Grimberg. Make sure to subscribe wherever you get your podcasts. To learn more about Dr. Mary, head on over to drmarygrimberg.com. And make sure to follow Dr. Mary at Dr. Mary PT on all social channels. To learn more about Dr. Mary's integrative practice for pain relief in Austin, Texas, head on over to resilient-rx.com. Thanks for listening.